Hello, I'm Dr. Steve Hotze. God has given your body amazing restorative power. That's the natural ability to heal itself. This is known as the body's innate regenerative capacity. Now, stem cells play a major role in the regenerating process. Stem cells exert their influence by producing biologically active molecules called exosomes, which modulate the immune system and they stimulate cellular healing. Over the past several years, I've been extremely interested in offering stem cell treatment to our guests. However, the FDA prohibits the most beneficial stem cell therapy. Prior to 2014, stem cell companies could harvest stem cells from bone marrow or from fatty tissue in the mesenchymal cells and then put them in a medium where they would expand and grow into hundreds of millions of stem cells. These stem cells were then given intravenously or directly into patients' joints. This is what the FDA has prohibited. People now have to travel outside the country to obtain this treatment, which is very expensive and very inconvenient. Now, in the past, stem cells were believed to provide the regenerative effect, transforming themselves into type of cells that had been damaged. In the joints, stem cells were thought to become cartilage. But what we found over the past several years through research is that the beneficial effects of stem cells aren't related to their ability to differentiate into the cells that have been damaged. Rather, stem cells secrete biologically active molecules known as exosomes, which create an environment where the injured tissue can regenerate itself. Exosomes can be given intravenously or directly into the joints. Let me give you an analogy that will help you understand the relationship between stem cells on the one hand and exosomes on the other. Many oil refineries line the Gulf Coast. Crude oil is pumped through pipes to the refinery and they're refined into various petrochemical products such as gasoline and diesel, butane, and propane. These products are shipped then to the various industries that use them. When you pull up to a gas station, you fill up your car with gasoline that was produced at the refinery. So think of the stem cells as the refinery and the exosomes as the gasoline. There are scores of articles in the medical journals about the regenerative health benefits of exosomes. Over the past year, I have attended medical conferences to learn about exosomes and how they can be used to help restore a person's health. I visited FDA-approved tissue laboratories that produce and extract exosomes for clinical use. The more I've studied about exosomes, the more excited I've become about offering exosome treatment at the Hotze Health and Wellness Center. Exosomes are nano-sized particles that play a key role in cell-to-cell communication. They're peptides, they're proteins, they're anti-inflammatory molecules, they're cytokines. These are the molecules that are produced by the stem cells, which we call exosomes. Now, these exosomes decrease inflammation. They contribute to the tissue and organ repair in the body. They support neural communication and they enhance the viability and the activity of the mitochondria. Remember, the mitochondria are those power plants, those generators contained in every cell that produce electrical energy to let the biochemical processes run. Exosomes also participate in rejuvenating, in regenerating, in revitalizing aging cells. Exosomes are a catalyst for whole body health. They've been used for pain management, for immune support, and for tissue and organ repair. Let me give you some key points about the exosomes that we'll be using here at the Hotze Health and Wellness Center. First, they're ethically sourced. That means they're donated by consenting mothers who passed a comprehensive medical background check and blood screenings, and they come from full-term live C-section births. And they come from an FDA-registered tissue bank. Secondly, third-party testing is done on every batch of exosomes to determine their sterility and to determine the amount of exosomes contained. Third, We use single generation harvesting. That means there's a new placenta used for every batch of exosomes to ensure that we produce exosomes with the highest potency. And finally, there must be sufficient exosomes for the treatment to be effective. For example, in a knee, we'll inject 50 to 30 billion, that's with a B, exosomes. Intravenous treatment contains 75 billion exosomes. I'm so excited about incorporating exosome treatment into our health and wellness program here at the Hotze Health and Wellness Center. It has shown great potential for allowing individuals to have an additional way to improve and restore their health. Now, I believe that you and every individual deserves a provider, a doctor, and a team of professionals who can coach you on the path of health and wellness naturally without the use of pharmaceutical drugs. So as you mature, you've got energy, vitality, and enthusiasm for life. Now, I want to share with you a wonderful story by one of our guests, Steve Martinez. Steve came to our office complaining of severe lumbar back pain that has been going on since he left the military over a decade ago when he suffered an injury. He came to our center and was seen by Debbie Yannick, our nurse practitioner, who injected exosomes into his lumbar back. He's had a remarkable recovery with the use of exosomes, and I want to be able to provide you with the opportunity to have remarkable recovery for any injuries you sustained. So don't hesitate to give us a call here at the Hotze Health and Wellness Center, and we'll be glad to help you. Now let me introduce to you Steve Martinez and our nurse practitioner, Debbie Yannick.
Thank you, Dr. Hotze, for your introduction on exosomes. That was very informative. My name is Debbie Yannick. I am a nurse practitioner here at Hotze Health and Wellness Center. I'm actually the injection specialist, and I'm here with Steve Martinez. He's a guest of ours, and he's also been a patient who's had exosomes injected into his body, and we're going to ask him questions about his experience. So, tell us a bit about your symptoms you were experiencing and why you decided to do the exosome treatment.
Absolutely, Debbie. So thank you everyone for, again, for having me here. And so my experience was amazing. And like before I came to the Hotze Health and Wellness Center, I was in bad shape. I was, a little history about my story is I'm a veteran, and I was in the military, and I experienced a very, very traumatic accident in the military where I pretty much ruptured my lower lumbar. L3, L4, L4, L5, L5, S1 was just ruptured, and that happened in 2005. And since that time, I've always experienced lower back pain and difficulty, but I re-ruptured so I had surgery in 2016, a little microdiscectomy to kind of take out the little bit that was impinging on my spinal column. And then I was feeling good since that time and, had a little bit of difficulty, but nothing major. And then in November of 2019, I re-ruptured my back. I had another accident, and that literally put me to the floor. I had a hard time, walking, putting on my shoes, getting dressed in the morning. I had a hard time sleeping, eating. My life was just taken over by pain. And so I was searching for answers. A lot of times, the conventional approach, is anti-inflammatories, pain pills, things like that. Nothing touched it. And so me being a functional medicine practitioner myself, I was always searching for the latest and greatest. How can I actually heal and regenerate my body, my tissues, my muscles, and heal the system instead of just covering up the symptoms? And that's what I didn't want to do. And so when talking to Dr. Hotze, he's been a great friend and mentor of mine, and very thankful for everything he's done for me. And so he said, you got to look into this. And so I did. I took his word for it, started researching what exosomes were and how they function, what the benefit that they could provide for not only myself, but so many people out there that's experiencing chronic pain, especially chronic pain within joints. And so I paid a visit, and you were the one that actually helped me out. And so I did a series of injections, and then, about slowly I started seeing the difference as far as, a little less inflammation. I was able to move a little better, getting, a few more hours of sleep at night. And these are the things I was getting my life back, the quality of life. Because I think so many times when people are in a chronic pain state and they weren't before, it's amazing what you realize that, how thankful we need to be to have, to be able to do the things that we do on an everyday basis, because when they're taken away, that's a world changer. That is a world changer. So yeah, I mean, like I said, I was very thankful for the opportunity and the help I received here. And like I said, little by little, that was in March, and little by little things started getting a little better. And then, like I said, I'm able to walk around and, play with my little boy and, do the things, cut the grass, do the things that I wanted to do in life and that I was able to do before. I got that back. So I'm doing great.
That's wonderful, because if you got a small child and you're not able to participate in their life, that's kind of not being a real good parent for them either. So that's good.
It's one of the main things I'm happy about.
So prior to the whole exosomes and I guess you had surgery right off the bat.
Yeah, well, so my initial injury was 2005, and then since that, I was able to kind of, manage it, stretching techniques and, core work and things like that. Nothing really invasive though. But then in 2016, things just started to deteriorate on me. Since 2005, 11 years later, things started to literally fall apart. And the neurosurgeon that I paid a visit to, he actually said during the operation, when he was taking out the area of the disc that needed to be removed, he said it was like crackers. He said it was just so brittle. It wasn't that jelly buoyancy disc that we normally have. So I have a situation called DJD, and my discs are extremely desiccated, meaning they're extremely dry. Right. And so trying to find therapies to help, heal and hopefully regenerate those discs is something that I've always wanted, but like I said, now the science and the research is coming out and say, hey, we have opportunities and things we can do to help achieve those goals and not just have to rely on only surgery or only pain pill for the rest of your life or anti-inflammatories, things that will cause, secondary effects if we continue with those for a long period of time, which nobody wants to do. So that's why I'm excited about exosomes and personally experiencing it right now. So.
All right. So I'm taking it that your treatment has been very successful for you so far.
Yes. Very happy.
Who all are you spreading the word to?
Everybody can. Everybody can. Yeah, anybody who listens to me, because I think it's new for a lot of people. What are exosomes? What do they do? And what are stem cells? I'm sure they may have heard the words before, but to really understand the function of them is something that we as clinicians have a huge opportunity. Right. To really explain, to teach, and not only just tell, oh, you need this or you need that, but let's sit down and take the time to learn about it to see if it's a good therapy for you.
Well, people know the term stem cell. That's been out there for 10 years.
Absolutely.
But the whole exosome with the nanoparticles and the punch that they can pop is very new on the forefront.
Little soldiers, migrating out there to do the job, the worker bees, I guess. And that's the amazing part, that we're able to extract those now to place them within us exogenously to help, again, regenerate and repair, which is what we want. What we want. If we can heal our body, that's what we do, and that's the amazing blessing we have.
Right. So we have a lot of people that come to the clinic and they are getting these exosomes in through IV, and IV is simply where you have a needle put in with a little catheter into a vein, and they are dripped into your body, and when they're put into the body in that manner, they're able to go anywhere in the body to do what they need to do. And then we do specialized injections, the joint injections, where we can go into hips, we can go into knees, we can go into shoulders, and for some people we go into their backs or around their backs. But we're able to pinpoint by looking at the MRI where the damage is, and then with ultrasound guiding go in there and actually deliver it to the area. When we prep somebody for this, we do have a numbing spray, so that kind of takes the ouch out of the needle going in. And we're as gentle as you can be. And it's not, tell me, was it very painful for you?
You did a very good job, Debbie. I thank you for that. No, it was very simple. It was very simple. Like I said, you do feel a little bit of a poke, you know, but it doesn't last, you know, the whole procedure. It's the initial, like you're getting a little shot, and that was about it. And like I said, after that point, you know, it was very comfortable. You know, for my situation, I was, you know, on my stomach, you know, and like I said, it was very, you're not going in blind. You're not just taking a guess on where to inject. It's very you know, it's precise what we do, you know, through the MRI and through, you know, just your experience of anatomy. And so it was great. It wasn't bad at all. It was very quick, and you know, like I said, it wasn't bad. I would do it again. So.
And obviously, if you would be willing to do it again, then you're seeing positive results from it.
Absolutely, yeah. So it wasn't a long procedure. I was in and out probably within 30 minutes. You know, everyone explained, you know, what was going to take place, what I was going to feel, and everything was on point. It was correct, and it was very good.
I think the largest part of time is like when you come in, you have to have your blood drawn so that we can spin down the platelets, and then once you get the injection mixed up, it's simply finding your location and going in and giving it.
Yeah. The injection didn't hurt when you were injecting. Like I said, just a little poke in the beginning, and that was it. Very simple.
So what are some of the things that you can do now that you didn't feel like you could do prior to your injection?
A whole lot.
Well, can you expound a little bit on a lot?
No, like I said, I got my life back, literally, because it was taken away from me. And it was for those 3 months, you know, 24 hours a day of pain. I mean, I felt like I was trapped in a cage. I could not break free. It was like, well, no matter what I did, how I moved, how I positioned myself, it didn't matter. I mean, nothing was working. So, like, it's the normal everyday things, like as far as tying my shoes, you know, walking to the kitchen. I couldn't mow the lawn. I couldn't, you know, take care of my little boy. I was just literally just trying to find a position on the couch to lay down, and hopefully that the pain would just ease a little bit. So the everyday quality of life things, just as, you know, a husband and a father, as a man, I wasn't able to do it all. You know, I love exercising. Forget about that. I mean, I could barely, my exercise was just trying to walk from, you know, my bed to the bathroom, you know, really. So those types of things were taken away from me. And so after the therapy, you know, I started seeing improvements right away. And, you know, week by week, I started noticing a little bit improvement, baby steps. It wasn't like a light switch where everything, boom, just kind of turned back on. It was little by little. But those things were very encouraging, like little victories, right? Little achievements along the way that really helped me, you know, develop that, you know, that excitement and that optimism, that enthusiasm that I wanted, because for a long time, I was like, man, I will never get back to where I used to be. And so, yeah, I was able to, hey, you know, tell my wife, don't worry about this. I'll put on my own shoes today. You know, things like that, because that's what helped, you know, those little victories. And then, you know, I was able to, you know, walk around a little bit more, you know, help cook dinner, wash dishes. You know, when my little boy wanted to wrestle, I was able to do a little more. You know, things like that, things that we all enjoy, that we take for granted at times. I was starting to get those back. So now, going, you know, fast forwarding from March till now, I feel almost 100%. I mean, I'm able to get back almost everything that I was able to do before. I'm able to participate in now.
Wow, that's an incredible, incredible story.
You know, it's nothing short of a miracle. So I'm very happy, very thankful. You know, like I said, I still, you know, very excited to continue to improve, and especially after I get my next MRI to see the improvement and everything. But I know the way I feel right now, there's no doubt there's improvement, and things have changed, but in the right way.
Perfect. Perfect. So when we do the injections, or we have somebody call the clinic that wants to participate or see if they are a candidate for Exosomes, if they are already a guest here, we visit with them shortly. We encourage them to get an MRI. We do have some sets of blood work that they need to have done. Then once the MRI comes back, you know, I'm able to look and see exactly where the damage is at, so that I have an idea where I need to put the needle. And then you come into the clinic. It takes a little over an hour from start to finish. You come in. We draw blood. That takes the longest amount of time because we have to spin it down. Then we draw out the platelets, and we put the exosomes, and depending on where we're injecting, Morton's jelly, and we prepare the injection, and then we clean the site, and we get it done.
Yeah, very simple, very, very straightforward. You know, I wasn't here all day.
Right.
You know, it was very, yeah, it's always an enjoyable place to be. So I wasn't, you know, well taken care of. But yeah, it was very simple from start to finish, and it was a smooth process.
I was sent to Denver to have some specialized training to be able to inject these joints. My background's operating room, so I was always very comfortable putting IVs in people and sticking tubes in places.
Yeah.
This is a little more specialized. I feel very confident with the training that I got, that I'm able to, if I need to go into a hip tear, I can stick the needle where I need to go, or if they have a torn meniscus, that I can put it into the meniscal tear to give them the best benefit of the exosomes and their regenerative properties.
Yeah, and I think a lot of people might have a little reservation or a little bit of hesitancy. It's like, okay, well, they're going to inject where, or is this close to my nerves and things like that. But no, I mean, like I said, you did an amazing job, and I didn't feel any type of residual pain or numbness or tingling, anything like that. If anything, it was the opposite, because I felt great, leaving, and I felt definitely a rush of just gosh, I don't know how to explain it. It was just over. Of peace, I guess, because my body feels like, okay, now I get to relax a little bit and start regenerating in the way I want, and the exosomes played a huge role in that.
You got the secret sauce.
I did, secret sauce, yep.
The secret sauce to come back and start regenerating yourself. So.
Absolutely. So Debbie, I'm a guest here at Healthy Health and Wellness Center, and so, but what if I wasn't? What would I do to gather more information about exosomes and even participate in exosomes therapy?
So we also offer exosomes, and we love non-guests. We want to spread the capability that the exosomes are able to do for the joints and for just overall regeneration in the body. If somebody wants to come in and have a procedure done or to even visit, they need to call the Hotze Health and Wellness Center. They will speak to one of our consultants, wellness consultants, and they will visit with them about the appropriateness of it. And then if they think that it's a good fit, then they will make an appointment to visit with me, and from there we send them out for an MRI, and then we come back and we get our game plan together and go forward with whatever they need to have done, whether it be an injection or an IV treatment.
Wonderful.
So we're able to treat many modalities. So Steve, I want to just personally thank you for making the trip to come see us today. And I know that you're experiencing positive results from the procedure that you had done. Is there anything else that you would like to express to?
Yeah, I just want to say thank you. And if anyone out there is watching that has experienced chronic pain, especially chronic joint pain, and they've lived with it for years and have tried all kinds of different medications or different types of therapy, or it hasn't been working, or if they're told, well, sorry, there's nothing else we can do, you're going to be like this for the rest of your life, there's more to the story. There's more answers out there that you can receive and benefits that you can experience. And I think exosomes will play a huge role in the future of regenerative medicine, because that is what it's actually doing, is helping to regenerate your tendons, your tissues, your ligaments, your muscles, and your cells. And that's where we feel the best, and that's where we can move past these chronic or even acute issues that we might experience to get on that path of health and wellness and have the vitality and the enthusiasm, the strength, and the energy that we all want. Right. I think that we owe it to ourselves to at least ask the question of, how can I learn more? How can I, benefit from this? And I think people will be, extremely happy with what they learn.
Thank you very much.
Yeah, thank you for having me. It was an awesome time.